Chapter 11, Health Problems of Infants. Vitamin disturbances. The chart in your book of vitamins, the only one I want you to know about is vitamin D. You don't have to memorize the other vitamins. And the problem with vitamin D deficiency leads to rickets, which is a bone disorder. Now, the American Academy of Pediatrics has recommended that infants who are exclusively breastfed should receive 200 international units of vitamin D per day beginning at age 2 months, or no later than age 2 months. And that children, so over a year, who have minimal sun exposure, either because they're not out in the sun or they live in a cloudy area, and they don't consume at least 500 mLs of milk that's vitamin D fortified every day, and they're not taking vitamin D supplements, that these kids should also get vitamin D supplements. So infants and then older children who don't get much sun and don't drink very much vitamin D milk. Vegetarian diets. Everybody, the American Academy of Pediatrics and your nutritional agencies are all saying vegetarian diets are healthy, including for children. The stricter the vegetarian diet, the more problems you have, however. If they can have dairy products and eggs, it's really very healthy. When you get to your vegan diets, that's where it starts being difficult to get balanced nutrition. And the problems there are protein and calories, and also vitamin deficiencies. And so our main nursing goal is going to be to identify if there is a nutrient imbalance. Malnutrition problems. There's two different types. There's this kwashiorkor, which this is what you've seen the pictures of kids with the really distended abdomens. This is where they have a deficiency of protein, and they might have adequate calories, but they're in simple carbohydrates. These kids, they don't have enough protein, so they don't have enough protein in the blood. That those blood proteins, that albumin in the blood, has that oncotic pull to pull fluid into the bloodstream. If you don't have that, that fluid goes out into the tissue, and you end up with the distended belly. It's ascites. They look thin, wasted. Their extremities are very thin, with that big edematous abdomen. Now, marasmus, these kids have a deficiency of basically everything, protein and calories, but because it's kind of across the board, they don't develop that big distended abdomen. They just look thin, and they don't look chunky and healthy. Their skin looks thin and kind of withered. This can be a syndrome from physical, but it also can have some emotional components, or can contribute to it. Food sensitivities. The most common foods that kids are allergic to are milk, eggs, wheat, nuts, fish, shellfish, and soy. Now, food allergies or hypersensitivities, this means there's an actual immune reaction. Usually IgEs, or it can be also non-IgE, but you have that whole histamine kind of reaction. Allergies are often a genetic component, so if parents have allergies, there's a good chance the child will too. Kids who have severe life-threatening allergies, where they go into anaphylactic shock, they need to have an EpiPen. And with especially if there's a family history of food allergies, we really want to encourage breastfeeding. The later kids are introduced to other substances, the lower the chance of food allergies. So let's encourage breastfeeding for that, exclusive breastfeeding that first 6 months. Now, intolerance is not the same as an allergy. This means they're missing an enzyme, so they can't digest whatever it is. Usually lactose is the one where is probably the most common, but it doesn't cause that whole immune response where you have the histamine release. So cow's milk allergies. If somebody is truly allergic, this is, your histamine release, full-blown allergy, not just an intolerance to it. We want to eliminate cow's milk from their diet. We can do a challenge test and kind of reintroduce small quantities to see how they do, because sometimes this is not necessarily a lifelong thing. We'll put them on formulas that are either progestamil or Nutramigen. These have the proteins broken down to their elements, their elemental proteins. So they're as if they're already digested. They're in a pre-digested state, the proteins in the formula. We do that as opposed to soy formulas when there's a true allergy. Now if it's a lactose intolerance, so these kids just can't break down the lactose because they don't have that enzyme, we can use soy. We do want to eliminate the lactose they get, and mom drinking milk, some of that lactose will come through in her breast milk, so we may have to have mom eliminate milk as well. These kids a lot of times can have yogurt because there is some lactase, the enzyme in yogurt. Colic, paroxysmal abdominal pain. This usually goes from about 3 weeks to 3 months, so it's usually kids under 3 months, and this is abdominal pain with loud crying, and they'll drop their legs. Sometimes if we eliminate foods from either baby's or mom's diet, we can minimize this, sometimes not. The other treatment is putting the baby over something warm, either a hot water bottle or a warmed up towel, just for some warmth on their abdomen. So we lay them prone on that, massaging the belly, putting them in a front carrier so their belly is against the parent, taking them on a car ride. That vibration often helps. Using bottles that make less air, so the ones that have a bag inside that kind of shrinks, or the nipple that's shaped a little differently so it fits better into the mouth. And no smoking, not having them around smoking helps with colic. If it's really severe, they will consider medication for it, such as phenobarb, Atarax, chlorohydrate. Those are fairly potent medications, but they can be considered. Mylicon is very common. That's not such a strong medication. That's an anti-gas, because a lot of these kids, whether the gas causes it or not, the prolonged crying, they swallow a lot of air and end up really gassy, which makes them even more uncomfortable. So the Mylicon usually helps. And here's a picture of holding a baby with croup, and I'd say that baby should even be a little more prone. I think she just has them up so you can see the face. But so you're supporting their abdomen, and kind of bouncing and rocking movement seems to help. Failure to thrive. This can be organic, meaning there is a physical cause, or non-organic. And if it's non-organic, usually there's some psychosocial issue, or it can be idiopathic. We just never find out what causes it. So if we have non-organic failure to thrive, often this can be some sort of disturbance in the parent-child interaction. Things like poverty, health and child-rearing beliefs can cause this. Inadequate nutritional knowledge. Parents don't mean to cause it, but they just don't know enough. Family stress, feeding resistance, insufficient breast milk. All of those can be part of those non-organic reasons. It's defined as a child being less than 5th percentile on their weight for age on the growth chart. And the management, we want to reverse whatever malnutrition has happened and educate parents if that's part of the problem. Positional Plagiocephaly. This is a lopsided head, oblique or asymmetrical head, and this has increased since we really started the Back to Sleep campaign. And the way to prevent it is to not lay the baby on their back all the time. If they're awake, put them prone. Let them play on their tummies. It's good for their muscle development. It's good for them, and then put them on their back to sleep, but tummy when they're awake. If They do lay one way, and they always like their head turned one way, and they develop this lopsided head. Sometimes the problem is tight muscles, so it's more comfortable holding the head one way. So exercises to loosen that muscle, trying to switch their head position so they don't always keep it the same way. You might have to go to physical therapy, or they can make a customized helmet to help get that head back into shape. Again, that's only going to be when it's really severe. And if it really is significantly severe and causing problems, they might even need to see a neurosurgeon or a craniofacial surgeon. SIDS, sudden infant death syndrome. This is the sudden death of an infant under 1 year of age that remains unexplained even after a complete post-mortem examination has been done. What they do find on that is pulmonary edema and intrathoracic hemorrhages. SIDS is the third leading cause of death between 1 month and 1 year. The Back to Sleep campaign has worked. Our numbers of SIDS have decreased 40% since we really started having parents put the babies on their backs for sleeping, so that does work. Some doctors will say there is no real such thing as SIDS, that there's perhaps something wrong in the brain stem, the part that regulates the cardiorespiratory control. We know maternal smoking, both during pregnancy and then smoke exposure of the neonate, makes a higher risk. Some of that may be that maternal smoking, they have smaller babies, and that also makes a higher risk. Co-sleeping also makes a higher risk. And just think about these parents. They are parents who have done nothing wrong. They go in to find their baby from a nap or in the morning dead. They say they heard no crying. There was nothing to alert them to a problem. The police are usually called, and the police need to make sure it's not an abuse situation, but so the parents are usually treated with some suspicion at first, and they're feeling bad, and now they're being treated as if they're potentially guilty. So by the time you see these kids or these parents in the ER, they've just lost a child, and everybody's treating them with some suspicion. So they're going to be pretty distraught. And here's sleeping with a baby. This was my favorite thing to do when my kids were little, to sleep with them on my chest, but it's better parents stay awake just to prevent that possibility of rolling over. Here's SIDS, the ages. Most are under 6 months and most are male. Apnea of Infancy. This is defined as greater than 20 seconds between breaths. So if a child goes more than 20 seconds between a breath, or it can be less than that, but if it also is accompanied by color change, marked change in muscle tone, so they kind of go floppy, or they have some choking and gagging as they kind of wake up and take that breath. This can actually be many different disorders that cause it, but half the time there's no identifiable cause. These kids, however, might be at risk for SIDS, and so they'll often order a home apnea monitor. Now the monitors are really kind of a pain, and they go off. The thing is, they do help, and whether they help because they wake the child up so that they take a breath, preventing that SIDS, that may be what it is, but they go off a lot. Often when they don't need to, they just, the monitor's leads don't pick up right. And so these poor parents don't get any sleep either, because they're hearing the monitor go off many times a night, every night. And the monitors don't prevent the SIDS. What it does is it notifies the parents quickly if there's a problem, and probably just the alarm wakes the child up. And that's the end of that chapter.